at the highest level, patient assistance programs are dollars set aside by drug manufacturers to help patients that are underinsured or uninsured um, get medicine in their hands. So if you know, the marketing of all these major, drug manufacturers for the latest greatest medicine, they're all over TV, right? And there's always something at the end that says, hey, call, XYZ manufacturer. They may be able to help you afford this medicine. They are setting aside billions of dollars a year to help patients that are underinsured or uninsured. And so what we are able to do with the right plan and the right, you know, education process is find those 2% of people that are driving about 50 to 60% of prescription spend with what's called specialty drugs. And we basically help them access those funds, and those funds then cover the cost of the medicine and the patient gets it for free. So it's kind of that win-win. Now, none of these strategies come without some pros and cons and things we need to consider. Keeping it high level, that's how the program essentially works, is we tap into those billions of dollars that have been set aside.
Yeah, and for the employers on the phone, there's income qualifiers that come along with this, right? So not everybody will necessarily get these. If you have a super high paid population, this strategy probably not a strategy that you want to implement. But if you have a lower paid population, maybe you're in the manufacturing space, that's where we see this is extremely successful. An example is a $25,000 drug called Stelara that we have on many of our plans. Had it on one of our plans. Patient applied for patient assistance, was approved, procured that $25,000 drug for free. We had a very small administrative fee, $500, to procure that drug. So the patient saved a huge copay because they were on a high deductible health plan, and the employer saved the remainder, which is $24,500 every time that script is filled. So, yep, I want to clarify now, because again, if I was on the phone and I was an employer, I'd be wondering, well, why can't I do this in my fully insured plan? Why can't I do this in my self-funded plan with Blue Cross or United or Aetna or Cigna, right? Can I tap into these right now? And the quick answer is no. Trevor, why is that?
Yeah, I think the short answer goes back to incentive alignment, right? So as drug costs go up and more high cost drugs come in, that's where insurance carriers and large prescription benefit managers continue to make more money. So it doesn't behoove them to actually eliminate that from the plan. It behooves them to pay for it and get a really large rebate on the back end to help with profitability and things like that. So that's really why the deck is stacked against you in a lot of healthcare plans, because they're incentivized not to keep costs down and find creative solutions. They're incentivized to just keep paying with your money. And so the patient assistance program, I will say patient assistance is probably the most volatile piece of the prescription ecosystem in America right now. There's a lot of things going on with manufacturers. Some people don't think that self-insured plans should be able to tap into it. There's different income requirements, as you know. So there's a lot to talk about with that piece. But as Mike said, for the right employer, it can work very effectively with the right partners.